So for those reasons,
the general message is that preventative point, that if it's workplace or school and hygiene practices, if we take that to heart, it's not going to be nearly as bad as it could be. But if people are careless, that's what causes the issues.
Right. Now, when you talk about getting down to some of the specifics, I mean, sneezing into your elbow or sneezing into the crook of your arm is
Yes.
very, very clear what that means. But when you're saying to people, hand washing, I mean, what really are you talking about in terms of hand washing that's good enough to kill whatever virus is on your hands? I mean, I go through this with I have a 6-year-old son at home, and we're always trying to tell him, when he's coming out of the bathroom or he's been playing or whatever, to wash his hands. And he'll go in and run the water for 2 seconds, and you can hear the water run for 2 seconds, and he's just run his hands under the water. He hasn't really done a lot.
Yes.
So what? Right. So and I'm glad he's young enough still, so he doesn't. If he watches this, he won't really be embarrassed of me telling his stories. But there is a right way and a wrong way. The point is, there's a right way and a wrong way to wash your hands. And so for the folks at home who are wondering, gee, am I doing it right?
If you're just using soap and hot water, then you really want to scrub your hands thoroughly for, say, with that hot water and soap for 30 seconds. And some people use the old method of kind of there's like tune that you sing while you're washing your hands to make sure it's long enough. But however that is, as long as it's thorough, and again 30 seconds with hot water and soap, that's good enough. Get
a good lather going, kill whatever's on your fingers.
Right, but the other thing that many people are using is the alcohol-based products that many of the schools are instituting those and having them different hand wash stations. They're having their nurses talk to the kids, teachers, and so again, that goes a long ways. And just that message of how to properly sneeze or cough into your arm versus just sneezing out openly. If kids understand that, and they are getting the message. You see a lot of kids now, they're actually doing that. And so that's going to go a long ways towards not spreading the virus.
Yeah, I've noticed, as a frequent traveler of the Massachusetts Turnpike and user of the service areas on the Turnpike, I've noticed that there are the alcohol-based, in the washrooms, there are now the alcohol-based dispensers.
Correct.
That are there for you to use, as well as washing your hands. You can also use those, which I think is a great idea. So the balance in terms of the workplace, I mean, that has got to be where it's tough, because people who may get sick may feel like they can't take time off. And I know, and you probably have had this too happen, where you're working with someone, they're sick, they come into work and they're standing next to you going, geez, I'm so sick, I wish I should have stayed home today, and they didn't, and now they're with you. So that's going to be a big problem.
Well, I would advise that if people don't know what the policy is at the workplace, to talk to your supervisor and get that clarified. But certainly that should be coming down from the top to all the employees, that get the message out clearly that we don't want you coming back if you have symptoms of flu. And if
we don't want you coming back right away.
Exactly, exactly. In some cases, that can persist for a while, as far as still being able to transmit that, to other people after symptoms, fever is gone. Usually it's 24 hours after that, but typically it can be longer. And in some recent studies have shown that you can actually still transmit that for up to 7 days afterwards.
Yeah, I think what I've heard is some of the studies I've read is that what's also concerning about this H1N1 is that even after someone feels better, they're still contagious.
They are. That's correct.
So that's going to be a problem, I think, as well.
But again, you still have, if you emphasize those hygiene practices, you think about those, and the message is clear from the employer to the employees that it's okay not to come to work, then I think that's going to go a long ways. And people have to think about that. If you don't have a good policy from the employer's perspective, you don't have a good policy, you're risking the potential of having a whole lot more of your workforce getting sicker, and with a large group of folks that imagine 30% of your workforce that can't be there. how can you function? So prevention from that perspective, it's important, and it's cost effective if you do it that way.
So if I were an employer, it may be in my best interest to say to my employees, if you get this thing, you stay home till you feel better.
Stay home.
Which is tough. I mean, that's tough for employers because they're, depending on your business, you're trying to make, you may need those folks to make money. So that's a tough thing. Now, what else is the Tri-Town Health doing literature? You're going
Yes,
out and
we're providing information. Mm-hmm. We're getting that out to the public. Mm-hmm. As soon as vaccines available, of course, we will let people know when the clinics are scheduled.
Where to go, when to get the shots. And again, we're not trying to spread fear or panic here about this, but this is a little higher level than the normal seasonal flu.
It's a higher level, but I still look at it as, let's deal with it as a routine flu season, just more clinics. That's all.
Right.
Another message I wanted to get out there to parents that either have to care for kids or they have child care. Make sure those providers are aware of H1N1 and what precautions they should take, because the potential there at the daycare centers, for instance, that they be on top of this. Parents should ask the questions. Are you aware of H1N1? What are the steps you're taking? And make sure that the parents understand. And it's tough for working parents, especially two working parents. What do you do with a child? You got a child that may be sick. You've got to work. That goes back with the employer situation.
Yeah.
So there's got to be that flexibility for parents to be able to properly handle this. Otherwise, it's going to get difficult.
Well, Peter, I want to thank you for coming in today and just having a brief discussion about this. Some of the information you're giving folks is a lot of it's common sense, but I think people need to be reminded of this. If folks want to get in touch with the Tri-Town Health, do you have a number? Or?
Sure. The number is 413-243-5540.
243-5540.
Correct.
And well, Peter, it's been great having you on today.
Thank you. It's a pleasure.
I wish you the best.
Thank you.
Thank you. So as you can see, there's a lot of information out there about this H1N1 flu, and a lot of good information, particularly on the internet. And there's a lot of good groups that are working at the local, at the regional, and at the state level to deal with any type of pandemic that comes along, including this one. So I would urge you to reach out to the resources that you heard about here today, find out the facts, make your own decisions regarding vaccinations. Remember that the basic preventative measures about sneezing etiquette and washing your hands are very important, and as well as being able to quarantine yourself if you do get this H1N1 or any flu for that matter. So there's information out there. It's even on my website. My website is Denis Guyer, Denis with one N, GUYER.com. I hope you'll go there and look at the information there. And you can contact me through the email link on my website if you have any further questions or comments about this show. It's been great being here today. I want to thank the great staff here at PCTV. I also want to thank Mike Koval and Stephanie Gravelise for helping me today with this, as well as Jeffrey Turner for helping me with this show today. It's been a great day. Thank you.